Hello everyone, I am Dr. Palak Singh, Department of Conservative Dentistry and Endodontics, BBDCODS, BBD University, Lucknow, and today I am here to talk about the topic Rotary Instruments in Operative Dentistry. Coming to the introduction, removal and shaping of tooth structure is an essential part of restorative dentistry. Initially, this was a difficult process accomplished entirely by use of hand instruments. In order to perform the intricate and detailed procedures associated with operative dentistry, dentists must have a complete knowledge of the purpose, availability, and application of many instruments required. Rotary instruments basically includes handpieces, burrs, and polishing instruments. Now, coming to the handpieces, there are different types of handpieces like straight handpiece, contra-angle handpiece. Straight handpiece, they basically, as you can see in the slide, the long axis of the burr lies in the same plane as long axis of the handpiece. This is basically used in oral surgery as well as in lab procedures. Whereas contra-angled handpiece, the head of the handpiece is first angled away from and then back towards the long axis of the handle. Because of the design, burr head lies close to the long axis of the handle of the handpiece, which improves accessibility, visibility, and stability of the handpiece while working. Now, the contra-angled handpiece is divided into aerator handpiece and micromotor handpiece. The aerator handpiece, they basically get power from the compressed air supplied by compressor, and they operate at high speed and low torque. Whereas the micromotor handpiece, they get power from the electric motor or air motor, and they operate at high torque but at low speed. Now, depending on the speed ranges, there's a different classification of the speed. According to Sturtevant, it is classified into low speed ranging less than 12,000 RPM, medium in between 12,000 to 2 lakhs RPM, and then high, which is more than 2 lakhs RPM. Then, according to Charbonneau, it is divided into conventional low speed less than 10,000 RPM, increased or high speed 10,000 to 1,50,000 RPM, and ultra high speed more than 1,50,000 RPM. Then, according to Mazook, it is divided into ultra low, low, medium high, high, and ultra high. According to clearance, low conventional, that is less than 6,000 RPM, high intermediate 6,000 to 1 lakh RPM, and then ultra super speed more than 1 lakh RPM. Now, the speed is basically proportional to the rotational speed and diameter of the instrument. Low speed cutting is ineffective, time consuming, and requires relatively a lot of pressure application. This results in a lot of heat production and vibration of low frequency and high amplitude, thus resulting in heat and vibration, which are the main causes of patient discomfort. Therefore, low speed is basically used for procedures like cleaning teeth, occasional caries excavation, finishing and polishing procedures. At high speeds, the surface speed needed for efficient cutting can be attained smaller and more versatile cutting instruments. Advantages of high speed includes diamond carbide instruments. They remove tooth structure faster with less pressure, vibration, and heat generation. Now, the operator, they have better control and greater ease of operation. The instruments last longer when they are operated at high speed, and patients are less apprehensive as the operating time is reduced. Now, coming to the rotary cutting instruments, these are individual instruments intended for use with handpieces and are available in various shapes and sizes. This includes their common design characteristics, the burr classification system, and modifications in the burr design. Dental burrs. These are very important for questions for exams as well as for viva purpose. Dental burrs, each instrument consists of three parts. These are the parts of dental burrs. As you can see in the slide, this is head, neck, and shank. These are the three main parts. Now the head design, it is a working part of the instrument which consists of cutting edges or points. The shape and material used in manufacturing are closely related to its intended application and technique of use. Head design, they forms the basis of instrument classifications such as divided into bladed instrument or abrasive instrument. Now, the neck design is the portion that connects the head to the shank. Neck normally tapers from the shank to the head. The main function is to transmit the rotational and transitional forces to the head. It also provides visibility as well as ease of operation. The shank design is a part that fit into the handpiece. This accepts the rotary motion from the handpiece. It provides bearing surface to control the alignment and concentricity of the instrument. Now, different types of shanks are straight handpiece shank, latch type handpiece shank, friction grip handpiece shank. Materials used in manufacture of burrs. Mostly burrs are made up of steel burrs or tungsten carbide burrs. Steel burrs were the first developed burrs. This was designed for slow speed less than 5000 rpm, and thus it dulls very rapidly at high speed. They are cut from steel blanks parallel to the long axis of burr. Once they are dulled, cutting efficiency is reduced, increasing heat and vibration. Whereas a tungsten carbide burr, they perform better than the steel burr at all speeds. Superiority is greatest at high speed, and this is harder than steel also, so does not dull rapidly at all. And carbide is more brittle. Now, the burrs can be classified according to their composition, their motion, according to the shape, according to the length of the head, according to the usage. Burr design. Burr head consists of uniformly spaced blades with concave areas between them. Normally, a cutting burr has got 6 to 8 or 10 blades, and finishing burr has got 12 to 40 blades. The concave areas are called as chip or flute spaces. Actual cutting of the burr takes place from the edge of these blades. Parts of a burr head includes the burr blade. Blade is basically a projection of the burr head which forms the cutting edge. Each blade has got two surfaces, the rake face or the blade face and one clearance face. And the three important angles would be the rake angle, clearance angle and the edge angle. Now, this is also very important for exam purpose. The rake angle is the most important design characteristic of a blade. It is the angle which is formed between the rake face and the radial line. So the angle, if the rake face is lying ahead of the radial line, then we call it as negative rake angle. Whereas if it is behind, we call it as positive rake angle. And when it coincides with the radial line, it is called as zero rake angle. So for cutting hard brittle material, a negative rake angle minimizes fracture of the cutting edge, thus increasing the tool life. Carbide burrs, they have blades with slightly negative rake angle and edge angle of approx 90 degrees. Now the blade angle or the edge angle is the angle between the rake face and clearance face. So this was your rake angle, the angle between the rake face and the radial line, and the angle between the rake face and clearance face is called as blade angle. Now coming to the clearance angle. Angle between the clearance face and the radial line, angle between the clearance face and the work, we call it as clearance angle. Primary clearance angle is the angle the land makes with the work, and the secondary clearance angle between the back of the burr tooth and the work. The significance would be clearance angle that provides a stop to prevent the burr edge from digging into the tooth and provides adequate chip space for cleaning the debris. An increase in the clearance angle causes decrease in the edge angle. Now, there are certain measures which help in measuring the symmetry of the burr. That would be the concentricity and runout. Concentricity helps in direct measurement of the symmetry of burr. That is, it measures whether the blades are of equal length or not. Whereas runout, it measures the accuracy with which tip of the blade passes through a single point when the burr is rotating. That is, it measures the maximum displacement of the burr head from its center of rotation. Thus, runout occurs if burr has it off center, or when the burr neck is bent, or when burr is not held straight in the handpiece chuck. And runout, it basically causes a lot of vibrations during cutting and thus leading to excessive removal of tooth structure. Now, the additional features in head designs would be head length, long to reach full depth of penetration, the taper angle, and the neck diameter. Spiral angle, it produces smooth wall. In high speed, smaller angle is preferred to improve efficient cutting. And cross cuts, these are the notches on the blade edges to improve cutting effectiveness at low and medium speed. Cross cuts effectively increase both cutting pressure resulting from rotation and perpendicular pressure holding the blade edge against the tooth. heat treatment, and influence of speed. Now, the modification in burr design, there are certain modifications which was seen with the introduction of high-speed handpieces. Three major changes includes reduced use of crosscuts at high speed because they lead to production of rough surfaces. And the new burrs, they have reduced number of crosscuts and extended heads on the fissure burrs. This leads to carbide fissure burrs with extended head lengths 2 to 3 times those of normal tapered fissure burrs. Of similar diameter, they have high efficiency at higher speed with light pressure. Rounding of sharp tip angles proposed by Markley and Sockwell, such burrs will result in low stress in restored teeth. Therefore, the life of the burr will last longer. Now, coming to the rotary abrasive instruments, there are diamond abrasives, there are coated abrasives, and there are molded abrasives. Diamond abrasives, they have a greater clinical impact due to long life and effectiveness in cutting enamel and dentin. Introduced in United States in 1942 and was used popularly as grinding and finishing agents. Now, the diamond instruments consist of three parts: the metal blank, powder diamond abrasive, and metallic bonding material. Now, the abrasives which are used, they are classified based on the size of the particle of the diamond being incorporated. They are classified into coarse grit, medium grit, fine grit, and very fine grit. Larger particles, the areas for the particle is reduced and are widely placed. So when we have a coarse grit kind of abrasive, the area of the particle will be reduced and therefore widely placed, that the density will be low. During cutting, only a few particles comes in contact with the tooth surface, which increases the pressure on each particle, thus resulting in rough surface. Now, different types of burr, they have different head shapes and sizes. So they are available in wide varieties of shapes and sizes. Because of their design with an abrasive layer over an underlying blank, the smallest diamond instrument cannot be as small in diameter as the smallest of burrs, but a wide range of sizes are available for each shape. For example, round, fossil, barrel, flat end cylinder, beveled end cylinder, inverted cone, flattened taper, round end taper, flame, interproximal burrs, needle-shaped, pear-shaped, football, and donut. Other abrasives, as mentioned earlier, they are mounted and coated abrasives. Many types of abrasives were used in addition to diamond instruments. Now they are restricted to shaping, finishing, and polishing restorations. Classification: in these instruments, the head is composed of abrasive particles held in a continuous matrix of softer material. They are broadly divided into molded abrasive instruments and coated abrasive instruments. Molded abrasive instruments, they have heads that are manufactured by molding or pressing a uniform mixture of abrasive around a roughened shank or by cementing a pre-molded head. They have much softer matrix and tends to wear with use, thus exposing fresh abrasive particles. These kind of abrasives, they are mostly used in prosthodontics when you're trimming your dentures, like pink stone, white stone. They are basically used for finishing and polishing of the restorations. Rigid molded materials, they have rigid polymer or ceramics as their matrix, mainly used for grinding and shaping procedures. Whereas the coated abrasive instruments, as you can see in the diagram, these are the coated abrasive instruments and these were the molded abrasive instruments. So coated, mostly used for polishing the restoration, mostly discs that have thin layer of abrasive cemented on a flexible base. They allow the instruments to conform to the surface contour of the tooth or restoration, thus they have a flexible kind of shape. Unlike molded, coated abrasive instruments, they have to be discarded when they wear off. Whereas molded, when you use it, the topmost layer of the abrasive burns off and then you get a fresh layer of abrasive inside. So that's the difference. It is used in finishing certain enamel margins or walls for indirect restorations, most often for finishing procedures for restoration. Hazards with rotary instruments. Now, there are certain hazards which can occur while you're operating a patient, like you can cause pulpal damage or any kind of soft tissue damage. So, there are certain precautions which needs to be taken along with the procedure in order to avoid any such kind of damage. So, pulpal precaution: injury to the pulp are mostly cause of mechanical vibrations, heat generations, desiccation of dentin, transaction of odontoblastic process. The pulpal sequelae, it takes 2 weeks to 6 months depending on the degree of trauma. The remaining tissue is effective in protecting the pulp in proportion to the square of its thickness. Heat is produced by steel burrs more than the carbide burrs. Tools plugged within the debris, they causes more generation of heat. When used without a coolant, diamond abrasive, they cause more heat generation as compared to carbide burrs. Air water spray, it must be used along with the procedure. This basically acts as a coolant. It moistens the tissues, lubricates the surface, cleans and cools the cutting tool, thus increasing the tool life, clears the operating site. Soft tissue protections. Injury to it can like procedures, they can lead to injury to the lips, tongue, and cheek. Therefore, to avoid such situations, rubber dams are used to isolate the soft tissues. Use good accessibility and visibility to operating field. Patient instructed not to make sudden movements. Like if you're doing a patient, you need to instruct the patient prior the starting the procedure that they need to make a sign like raising a hand or making any kind of sign. You need to explain it to them so that if there's any kind of discomfort to the patient can give you the sign and you can immediately stop the procedure. Else, if that is not explained to the patient, they can just close their mouth, which can cause unnecessary damage to the soft tissue. And in case if any kind of accident occurs, it should hemorrhage, any kind of hemorrhage, it should be controlled with packs. The chance of mechanical pulp involvement during caries excavation is more with hand instruments rather than with rotary. Residual caries can be removed using a burr at low speed and light intermittent forces. For eye precaution, use of protective eyewear, eye damage from airborne particles, so high volume evacuation is advised, and this eye precaution is necessary both for the dentist as well as for the patient. Ear precautions. High pitched sound by some air turbine handpieces at high speeds, they cause potential damage to ears depending on the intensity or loudness, frequency, the duration of noise, and susceptibility of the individual. Inhalation precautions. Aerosols are fine dispersion in air of water to debris, microorganisms, and restorative materials. Cutting amalgam or composite resins produces some kind of submicron particles and vapors. Vapors from cutting amalgam mercury and that from composite resin results in release of monomers. Now, inhalation of such kind of monomers, they can cause irritation in the tissues or can lead to alveolar irritation. Therefore, a face mask with filters, uh, it causes filtration of the bacteria and fine particulate matter, but not mercury or any kind of monomer vapors. Now, this is also a very important part of lecture, infection control, as this is very important when you're doing a patient. Infection control has to be the most important thing in mind of a dentist. Latch angles, burrs, and rotary stones must be cleaned and sterilized. Handpieces are semi-critical instruments requiring sterilization. Motor end of micromotor must be covered with a single use of disposable plastic covering. Scrub and disinfection at the end may also be performed. Sterilization of burrs, very important question for viva purpose. First, what you do, you pre-soak the burr in a soap solution in order so that it loosens all the debris. Then you clean the burr either with a brush or ultrasonic system. And then for proper sterilization, there are different ways by which you can sterilize the burr, like dry clay, which is done at 160 degrees Celsius for 30 minutes, autoclave for 121 degrees Celsius for 15 minutes. Tendency of corrosion at the neck region is higher in autoclave, therefore the burr should be soaked in 2% of sodium nitrite prior to autoclaving. Chemiclave, chemical vapor under pressure 131 degrees Celsius at 20 pounds pressure, best suited for corrosion prone instruments. Sterilization of handpieces with metal bearing, scrub the metal bearing with water and soap and then lubricate and place in sterilization bag and then autoclave it. Lube free ceramic bearing, it must not be chemically sterilized, which can lead to damage to the internal parts of the handpiece. Chemical vapor pressure sterilization can also be used for sterilization of handpiece. Ethylene oxide gas they provides both internal as well as external sterilization due to the penetrating capacity of the ethylene oxide gas. But this takes longer time for sterilization. Dry heat is never recommended for handpiece sterilization. Now, the recent advances which are being introduced in the burrs as well as in the handpiece, single patient use burrs developed by CDC and ADA to minimize cross contamination and prolong sterilization protocols. Turbo diamond burrs, they have diamond free zone or continual spiral of blank space. The diamond free zone breaks surface contact with the tooth and thus allowing cooler and cleaner cutting. The continual spiral design leaves a smooth wall. Fiber optic handpieces. These are the handpiece which provides light at the working site. Shut-off delay allows illumination even after release of foot control. So there's no need to adjust the chair light along with it. If the light is projected through the handpiece, visibility and the ease of operation is there along with these fiber optic handpieces. Cellular optic handpiece. Handpiece can be repeatedly sterilized without any kind of light degradation. Now the loop-free ceramic bearing handpiece, these do not require any kind of lubrication, but care should be taken against chemicals. Two more modifications or the advancements in burrs are the fissurotomy burrs and the smart prep burrs. Fissurotomy burrs, the tip of the burr is smaller than number 1/4 round burr, helpful in conservative preparation. And the smart prep burrs, they are also known as polymer burrs or smart burrs. These are made up of polymers, self-limiting, effectively remove the decayed dentin without affecting the healthy dentin. That is, as these burrs are made up of polymers, so when you will use it in a cavity, they'll remove just the decayed dentin without even cutting any portion of the healthy dentin. So these are the very good advancements in the burrs. Hence, in order to conclude, the introduction of rotary powered cutting equipment was one of the truly major advances in dentistry. These advances have enabled us to move from operative dentistry to conservative dentistry. Proper understanding of speed and its implication in clinical use will help in providing an expertise treatment. Thank you.